We are moving on towards the details of the nose, and the bone of the nose is ethmoid bone. Let us look at the details of ethmoid bone after taking a coronal section of the skull. You have taken a coronal section of skull from right to left, and then you are looking at the bone of the nose, which is called as ethmoid bone. You know, ethmoid bone is hollow from inside, and because it is hollow from inside, it is having ethmoid air sinus. So you are telling that this will be some ethmoid air sinus, ethmoid air sinus? Yes, it is. What I see is that this ethmoid bone is forming the medial wall of the orbit. Yes, it is forming medial wall of orbit. Now, if you say it is forming the medial wall of orbit, then who is forming the roof? Roof is the frontal bone here. So if roof is the frontal bone here, then who is forming the lateral wall? Lateral wall, what you see here is the zygomatic bone. And if zygomatic bone is the lateral wall, then what is the floor? At the floor, what I see is maxilla bone. So this is just an orientation. Later we'll discuss more about that. But my point is, if you're talking about the orbit, you already know there are two bones at the roof, two bones in the lateral wall, four bones in the medial wall. How many are there at the floor? How many are there at the floor? Three. Three at the floor, four in the medial wall, two in the roof, two in the lateral wall. What is the bone right now in the roof? That is frontal bone. And which bone in the lateral wall? The zygomatic bone. And which bone at the floor? The maxilla bone. And having maxillary teeth. So this is maxillary teeth, upper teeth. Yes, maxillary teeth, upper teeth, maxilla bone. And what is the medial wall? The bone of the nose. Bone of the nose means ethmoid bone, and forming the medial wall of orbit and having a lot of air spaces. Yes, these are the air spaces, ethmoid air sinus. Now, as you're magnifying this area, you will talk about some parts of the ethmoid bone, like you will see that ethmoid bone is giving us superior and the middle concha. What is that? The turbinate. So there is some superior and middle concha or the turbinate. Yes. Remember, superior and middle turbinate is coming from the ethmoid bone, which is having ethmoid air sinus, which is also forming the middle wall of the orbit and also the floor of the anterior cranial fossa. And at the floor of the anterior cranial fossa, it is also forming the roof of the nasal cavity. You are talking about the cribriform plate of ethmoid? Yes, that will be the cribriform plate of ethmoid. So cribriform plate of ethmoid, I think when there is a fracture of the cribriform plate of ethmoid, the CSF will enter the roof of the nasal cavity, come out of the nose as the CSF rhinoria. Yes, if there is a fracture at the floor of anterior cranial fossa, CSF rhinoria. So what is there at the fracture of the floor of the anterior cranial fossa? Yes, fracture of the floor of anterior cranial fossa can be fracture of the cribriform plate of ethmoid. And what is this projection? That is called crista galli. What is crista galli? Crista galli is a midline projection in the floor of the anterior cranial fossa. Crista galli is a part of ethmoid bone. Yes, it is a part of ethmoid bone, and it is at the floor of the anterior cranial fossa. Can we see some more details of this bone? Can we tell about the inferior concha? Yes, questions come, and remember, inferior concha is a separate bone and it is not a part of the ethmoid bone, first of all. So inferior concha is a separate bone? Yes, inferior concha is a separate bone and it is not a part of the ethmoid bone. And where is it articulating? Right now, it is articulating with maxilla bone. And what is this maxilla bone doing? Maxilla bone is forming the roof. It is forming the floor and the medial wall of the orbit. Maxilla bone is forming floor and medial wall of orbit. Yes. And it is also forming the wall of the maxillary sinus. Oh, this is maxillary sinus now? Yes, this is maxillary sinus inside the maxilla bone. It's a pneumatic bone. So this is the maxilla bone which is forming the floor and the medial wall of orbit. Yes. And it is also articulating with inferior turbinate, which is a separate bone, not a part of ethmoid bone. It is a separate bone, not a part of ethmoid bone. And then what is it doing? It is forming the roof of the oral cavity. Roof of oral cavity. This is oral cavity. Yes, this is the oral cavity, and this is the roof of oral cavity formed by maxilla bone. So maxilla bone is forming the floor of nasal cavity. Yes, floor of nasal cavity. This is the nasal cavity. It is the floor. So this is the nasal cavity, and maxilla bone is the floor. Yes, and it is also the roof of the oral palate. Are you talking about palate? Yeah, this is palate. Palate is formed by palatine bone and maxilla bone. So this is the palate, which is formed by the palatine bone and the maxilla bone. Yes, palate is the roof of the oral cavity there. Now we are going to talk about the ethmoid bone in detail. So remove the ethmoid bone from here and talk about it. What is there? Did you notice that we were having a projection crista galli, which is actually in the midline of cribriform plate of ethmoid? So this is the cribriform plate of ethmoid for the passage of the axon of the olfactory nerve coming from the roof of the nasal cavity. Yes, at the floor of anterior cranial fossa. At the floor of anterior cranial fossa, when you talk about the cribriform plate of ethmoid, in the midline there is a crista galli. And what else? There's a downward projection. What is that downward projection? Perpendicular plate of ethmoid. So you are telling that this is the perpendicular plate of ethmoid. What is it doing? Nasal septum from above. If it is forming nasal septum from above, then which bone is below? That will be the vomer bone from below. So vomer is a separate bone and contributing to nasal septum in the midline. Vomer is a separate bone which is contributing to nasal septum from below, and what is from above? It is a perpendicular plate of the ethmoid bone. And what is this? Open spaces, open spaces. Those open spaces are basically ethmoid air sinus. Ethmoid air sinus. So it's a pneumatic bone. Yes, it's a pneumatic bone. I think it is giving some concha. What concha? There is a superior turbinate or superior concha. There is a middle turbinate or middle concha. Where is the superior middle turbinate? In the lateral wall of the nose. If you're telling this is the lateral wall of nose, then this is the nasal septum, then this is the roof of the nose. Yes, that is the roof of the nose, which is formed by cribriform plate of the ethmoid bone. This is all the ethmoid bone. I think ethmoid bone is forming some orbit relation. Yes, it is the medial wall of orbit. Orbit will be here. So this is orbit. Yes, that is orbit. This is the orbit, and that is where the medial wall, and the medial wall of orbit is chiefly contributed by ethmoid bone. It's very thin, papery, paper-like, just very thin paper-like structure. So medial wall of orbit. Yes, this is the ethmoid bone. Yes, medial wall, which is very thin, papery thin. Why it is papery thin? Hollow from inside, you see, hollow from inside. Ethmoid air sinus, papery thin. It's very thin wall medially. Okay, what is the next thing? Next thing, you are looking at the olfactory mucosa. What is olfactory mucosa? The one which is having olfactory nerve, neuron bodies. So neuron bodies of the olfactory nerve are here. Yes, where? Above the superior turbinate. There is nasal mucosa above the superior turbinate. So we're looking for the lateral view now. Yes, lateral view. This is superior turbinate, middle turbinate, inferior turbinate. Lateral view, lateral wall of nose. So lateral wall of nose. Yes. You're looking at lateral wall of nose, but this is, you are inside the nose now. Yes, we are inside the nose and looking at the lateral wall of the nose, because in the lateral wall of nose, we have the superior turbinate, middle turbinate, and inferior turbinate. And what is above the superior turbinate is the olfactory mucosa, olfactory neuron bodies. And what are they doing? See what they are doing. They are sending the fiber up. Where? To the brain. What is in the brain? Olfactory bulb and olfactory tract. So this is olfactory bulb in the brain and olfactory tract carrying the olfactory pathway. You can see that from the front view also we have discussed. This is the superior turbinate, middle turbinate, and inferior turbinate in the lateral wall of the nose, and this is the nasal septum. And my point is, above the superior turbinate, there is the olfactory mucosa. It is having the neuron bodies of the cranial number 1, which is olfactory nerve, and the axons will be puncturing the cribriform plate of ethmoid and then synapsing in the olfactory bulb of the brain, olfactory pathway. If you say so, remember one more thing. The shortest cranial nerve is olfactory nerve. The shortest cranial nerve is olfactory nerve because it has very short length. Which is the longest? Longest cranial nerve is vagus nerve because vagus fibers are so long that they can reach the scrotum. Vagus nerve is sending axon to scrotum. Why? Because to supply the testis, it has to supply the testis. You remember? I told you. Vagus nerve is quite long nerve and coming from the medulla oblongata, supplying the head neck region, thorax region, abdomen region, pelvis region also. Remember. So vagus is the longest cranial nerve. Yes. And the shortest cranial nerve is olfactory nerve because it is only this much length. Yes. Piercing cribriform plate of ethmoid bone and synapsing olfactory bulb and olfactory nerve. And you see this is olfactory bulb, olfactory nerve, and this is where you have the olfactory cortex. So this is the olfactory cortex now. Yes, this is the olfactory cortex, cerebral cortex. For the smell pathway? Yes, for the smell pathway. Okay, fine. What is next? Next, you have to look at the details of the nasal septum because there's a question asking who is forming nasal septum. Who is forming nasal septum? I think there was perpendicular plate of ethmoid from above and below was the vomer bone. Yeah, you know 2, but you should know more than 2. More than 2 for nasal septum. Yes. What are they? See, this is the nasal septum. Let's magnify it. From above is the perpendicular plate of ethmoid and from below is the vomer bone. Can we magnify it now? Yes, you magnify. But first you tell me the answer. Bony nasal septum. Bony nasal septum. Just now you told me 2 bones. Vomer and perpendicular plate of ethmoid. This I'll rule out. Now I am stuck. Sphenoid or nasal spine? Which is my answer? Your answer is nasal spine. Why? Because nasal spine is not given by nasal bone. Then who is giving? Nasal spine is given by frontal bone. Oh, there is some frontal bone also contributing. How many bones are contributing to nasal septum? Many. Let us see them. But remember, nasal spine is not by the nasal bone. Nasal spine is by the frontal bone. So if frontal bone is giving nasal spine, then what is the nasal bone giving? Nasal bone, yes. Nasal bone is giving us what is called as the rostrum. It is giving what is called as a crest. What is that? Crest. Crest. Crest of the nasal bone. Yes. Actually, for the nasal septum, we have 3 crests. Actually, 4 crests. You have 3 crests, 4 crests. What is this crest? Crest of nasal bone. And who else is there giving the crest? Let us find out, but this is the answer. Why this is the answer? Explain why this is the answer. Okay, we have to magnify this area then. And let us magnify it then. It is a sagittal section of the skull. You have taken a sagittal section of the skull and removed 1/2 of the skull and then looking at other half of the skull. To see the midline nasal septum? Yes. Let us magnify. As you magnify here, you will find there are many bones contributing to the nasal septum. Which one? See here. I told you it is the nasal spine of frontal bone, not the nasal bone. So it is nasal spine of frontal bone which is on the forehead. Yeah, on the forehead. No problem. So the bone which is on the forehead, frontal bone. Yes. And it is giving some contribution to nasal septum there. Yes, spine. Because nasal bone give you the crest, not the nasal spine. And who else is giving the crest? Who else is giving crest? There are total 4 bones which give the crest. This is one of them. This is one of them. Then what are the other 3? I'll tell you, but first you see, these are the 2 major bones contributing to nasal septum. If these are the 2 major bones contributing to nasal septum, then who are they? There is one coming from the above and it is called perpendicular plate of ethmoid bone, the bone of the nose. And what is coming from below? From below is the vomer. Vomer is from below. So vomer is from below. Yes. And ethmoid is from above. Yes. Forming nasal septum. Yes. And then it is the crest of the sphenoid at the roof of the nasal cavity. This is what? The crest of the sphenoid. Oh, one more bone giving crest. Yes. Sphenoid. Yes. At the roof of nasal cavity. Right. I think it is called rostrum of sphenoid. Yes. You can say rostrum of sphenoid or crest of sphenoid. Doesn't matter. Do you remember one thing we have discussed earlier? Shindylis is a suture at the roof of the nasal cavity. The shindylis, which is a suture at the roof of the nasal cavity, is sphenovomerine joint. When you say the sphenovomerine joint, where is the sphenoid bone? At the roof of nasal cavity. And where is the vomer bone? Coming from below, forming nasal septum. So vomer from below nasal septum. Ala of the vomer. Yes, ala of the vomer. Wings of the vomer. And what is going into the wings of the vomer? Rostrum of the sphenoid. It is a rostrum of the sphenoid. Then they form a suture. It is shindylis. What is this? This is the other two bones forming the crest. Which is the other two bones? I told you who is forming palate? Palatine bone and maxilla bone. Yes, right. This is the palate, which is the floor of the nasal cavity and roof of the oral cavity. So this is the palate, which is the floor of the nasal cavity and roof of the oral cavity. This is oral cavity. Yes. What is it doing? See, palatine bone is giving a crest and maxilla bone is also giving a crest. Okay, so you have the crest of the palatine bone and crest of the maxilla bone. So there are 4 crests now. One crest was given by the nasal bone. Yes. See, frontal bone was not giving crest, it was giving nasal spine. Otherwise, crest of the nasal bone, crest of the sphenoid bone, crest of the palatine bone, and crest of the maxilla bone. 4 bones giving the crest to the nasal septum. So we have to remember these bones which are forming the nasal septum. Which bones are forming the nasal septum, which is a major one? Perpendicular plate of ethmoid and the vomer bone. Then beyond that, 4 crest and 1 spine. 4 crest and 1 spine. So there is this ethmoid bone and vomer bone, the major contributor. Otherwise, there are 4 crest and 1 spine. Yes, that's why the question which you have seen is the answer here. Where? Bony nasal septum. I think bony nasal septum is so many crest. Okay, this is the answer. Yes, you know already. It is not nasal spine of the nasal bone. It was nasal spine of the frontal bone. That is how. So these are all questions which are coming. And you should be careful about the details. And we are going to the next thing. What is the next thing? To draw the diagram. So you want to draw the diagram of nasal septum now? Yes, schematic diagram. So when you draw the diagram of nasal septum, what will you draw? What I will draw is a schematic diagram. Yeah, what is the schematic diagram? Draw it. As you draw the schematic diagram, you will find 2 bones are here. And who are they? Then we'll also see that 1 bone was coming like this. Who is that? We'll also see 1 bone was at the roof. Who is at the roof? And then we'll see that there was 2 bones at the floor. And who are the 2 bones at the floor? And then 1 was coming from the floor. Who is this coming from the floor? What are these bones forming nasal septum? So you can see that it will be actually the perpendicular plate of ethmoid coming from the roof. And what is coming from below? What is this? This is the vomer bone. Where is vomer bone going? It is articulating with the sphenoid bone. You mean to say body of sphenoid? Yes, body of sphenoid, which is having a rostrum there. It is giving rostrum. Rostrum is also called crest. So this is the sphenoid bone. Yes, that is the sphenoid bone, and it is giving some rostrum or crest. Who else is giving crest? That was this palatine bone and then the maxilla bone. So here you are telling that this is the palatine bone here, right? And forming the palate. Yes, but the palate is also formed by maxilla bone. So this is the maxilla bone, which is giving a crest to the nasal septum. Yes. And palatine bone giving a crest to the nasal septum. Yes. And this is the ethmoid. This is the sphenoid bone, which is giving some crest to the nasal septum. Yes. And then who is giving the crest? It was the nasal bone. If the nasal bone is giving the crest, then what was the frontal bone giving? Frontal bone. If you say frontal bone, then frontal bone was giving us the spine. That was the spine. So this is crest. Yes, that is the crest of the nasal bone, and that is the spine. Yes, that is the spine of the frontal bone. So nasal bone gives the crest, and maxilla bone gives the crest, and the palatine bone gives the crest, and the sphenoid bone gives the crest. Yes. And frontal bone gives the spine. Yes. And in addition to that, there is this perpendicular plate of ethmoid and the bone from below. That is all in the nasal septum. Yes. But now you have to look at the lateral wall of the nose. Lateral wall of the nose. The turbinates. Yeah, turbinates, but some more things. What is some more things we have to see in the lateral wall of the nose then? Let us find out. What is this? Some complicated structure again? Yes, there is a complicated structure, but you have to learn this. I told you, examiner wants you to become an ENT surgeon before you actually get entry into PG seat of otorhinolaryngology. These are all appearing to be MCH type of questions which are asked to the MBBS questions. MBBS students actually. What is happening? You have to learn the bones in the lateral wall of the nasal cavity now. Okay, fine. Can we discuss them now? Yes, you discuss. You have to magnify and discuss. So what are the bones? You know already. There was this middle turbinate and superior. So this is superior and middle turbinate. Where is inferior turbinate? Inferior turbinate is a separate bone and it is here. So you're telling this is inferior turbinate and it is a separate bone. But is it in the lateral wall of the nose or not? Yeah, of course they are. There are 3 turbinates in the lateral wall of the nose, and the superior and middle turbinate come from the ethmoid bone, the green bone here, and inferior turbinate is a separate bone. The inferior turbinate is articulating with many bones like maxilla bone, and it is also articulating with the lacrimal bone. And see here, lacrimal bone now. If that is the lacrimal bone, fine. Is the lacrimal bone also contributing to the lateral wall of the nasal cavity? Yes, it is. Okay, then can we discuss some other bones contributing to the lateral wall of the nasal cavity? Yeah, I told you. Ethmoid bone. Not only the turbinates, but it has some. Ethmoid bone has a labyrinth. Ethmoid bone has some labyrinth? Yes. What is labyrinth? Labyrinth means some chamber, some chamber. So ethmoid bone has some chamber, yes. And in the lateral wall of the nasal cavity, yes. And giving some projection which is superior turbinate and middle turbinate, yes. Okay, contributing to the lateral wall of the nasal cavity along with inferior turbinate. Who else is there? Lacrimal bone. This lacrimal bone, yes, that lacrimal bone. As you're telling, this is the lacrimal bone contributing. I think there's one more bone contributing. Who's this? This is the maxilla bone. You remember, this is the maxilla bone. So this is the maxilla bone which is contributing now. Yes. You're telling that maxilla bone is contributing to lateral wall of the nasal cavity. Yes. And lacrimal bone. Yes. And ethmoid bone. Yes. And palatine bone. Yeah, correct. Palatine bone. This is now the palatine bone. So this is the palatine bone. Yes. I think perpendicular plate of the palatine bone. Yes, perpendicular plate of palatine bone and sphenoid bone also. Sphenoid, where is sphenoid? It is the medial pterygoid process of the sphenoid. Medial pterygoid process of the sphenoid, the butterfly. Yes, this is the butterfly having sphenoid air sinus. It's a pneumatic bone. So this is sphenoid air sinus pneumatic bone. Yes. And it is having a pterygoid plate, the medial pterygoid plate. Yes, remember, medial pterygoid plate and the perpendicular plate of the palatine bone forming the palate roof of nasal cavity, and also the 3 turbinates, and also lacrimal bone, and also front. This is the maxilla bone, and also nasal bone. Nasal bone, this is nasal bone. Oh, nasal bone is also contributing now. Yes, it is. There are so many bones. I'm giving some exam for MCH, ENT, MCH, some course, some facial-maxillary surgeon I'm becoming. Yes, you are already becoming before you are getting a PG seat for MS, MD, ENT. You have to become first, before that only. You should have all that information. That kind of questions come these days, you know. Can you see one thing here? This. What is that? That is a projection, uncinate process of the ethmoid. A question has come. You are telling there is some uncinate process of ethmoid in the lateral wall of the nasal cavity? Yes. Uncinate process of ethmoid. Sir, nothing is seen. You have colored everything. Oh, I have colored everything. You want to see that uncinate process? Let me show you. Now, can you see? No, sir, it's very small. Okay. Can you see now? This. Sir, you are smiling and we are having so much problem. Yeah, sometimes you can smile, but it's a sad state of affairs, actually. It's a very serious affair, in fact. So, what is serious here? Shall I tell you? They're asking now. Uncinate process of ethmoid is articulating with which bone? And you will find it is too much for us. Uncinate process of ethmoid is articulating with which bone is too much for us. Shall we do it or not? Some topics go beyond our scope. Though I can tell you, but it's better that we avoid some of the topics. Though details are there, I can add on. But you are already oversaturated, aren't you? Just remember, medial pterygoid plate of sphenoid bone, perpendicular plate of palatine bone, inferior turbinate and the turbinates of the ethmoid bone, also the labyrinth of ethmoid bone, the uncinate process of ethmoid bone and also lacrimal bone and the maxillar bone and the nasal bone. And now we want to look at some openings in the lateral nasal wall, and those will be the opening of various sinuses. That could be frontal sinus, that could be ethmoid sinus, or deeper to the sphenoid sinus or maxillary sinus. They are all opening in the lateral wall of nose, and we want to talk about those openings. See, this is the frontal bone having frontal air sinus, and where is it going to drain into the lateral wall of nasal cavity? You will see that there is a sphenoid air sinus also. And where is the sphenoid air sinus opening? Then there is a maxillary sinus also, ethmoid sinus also. We want to see their openings. First of all, you should know that there is the superior turbinate and the middle turbinate and the inferior turbinate. Which is the largest turbinate? The inferior turbinate. Now, if you say inferior turbinate is the largest turbinate, then under each turbinate there is a space called meatus, and it is understood inferior meatus is the largest of all the meatus. So, we are telling that under each projection, which is called as turbinate or concha, is a space called meatus. Yes, if this is inferior turbinate, inferior meatus. If this is middle turbinate, middle meatus. And if this is superior turbinate, this is superior meatus. So, which is the largest turbinate? Inferior turbinate. And which is the largest meatus? The space under that, that will be the inferior meatus. What is the opening at the anterior end of the inferior meatus? What is opening at the anterior end of the inferior meatus is tear duct. Tear duct. What is tear duct? Nasolacrimal duct, nasolacrimal duct, lacrimal. So this is the opening of nasolacrimal duct. Yes. Coming from the orbit region. Yes, from the orbit region, tears drain into nose. So from the orbit region, tears drain to nose, and it is nasolacrimal duct. Yes, it is guarded by a valve that we will discuss. What valve? Can you see that there is some opening in the middle meatus? There is some hiatus semilunaris. So let us draw this diagram actually and discuss hiatus semilunaris in the middle meatus, because that is where you have opening of the maxillary sinus. Not only maxillary sinus but also frontal sinus, and not only frontal sinus but also ethmoidal sinus. So which ethmoidal sinus open here? What is this? Behind the inferior turbinate. That thing which is behind the inferior turbinate is the nasopharynx. Behind the nose, there is nasopharynx. So this is the nasal cavity. Behind that is the nasopharynx. What is opening the nasopharynx? Eustachian tube. Remember, eustachian tube open the nasopharynx behind the nasal cavity, behind the inferior turbinate there. And we are going to draw this diagram now. As you are going to draw this diagram, you will tell there is a superior turbinate and there is a middle turbinate and there is an inferior turbinate. Yes. And under that some space called as the superior meatus and the middle meatus and the inferior meatus? Yes. And also tell inferior turbinate is the largest of all the turbinates and the inferior meatus is the largest of all the meatuses. And what else? Then you have to tell that there is a orbit, and in the orbit you have the lacrimal secretions, and those lacrimal secretions should come into the lateral wall of nasal cavity. How? It will come like this. So we are talking about the opening of the nasolacrimal duct now. Yes. And where is the nasolacrimal duct opening? At the anterior end of the inferior meatus. And when it is nasolacrimal duct opening at the anterior end of the inferior meatus, that is guarded by a valve, and that valve is called Hasner's valve. Hasner's valve. It is actually controlling the flow of tears into the nose. And what is the frontal sinus opening into? Frontal sinus. Yes. I want to know where is frontal sinus opening, and I want to know where the sphenoid sinus opening. If you want to know where the sphenoid sinus opening, I'll tell you immediately. It is having a sphenoethmoid recess and open into the superior meatus, lateral wall of nasal cavity. So this is the sphenoid air sinus and opening into the sphenoethmoidal recess. Yes, it is sphenoethmoid recess, through that it will open into the superior meatus. And what else is opening? Actually, in the superior meatus, what opens exactly is the posterior ethmoidal air sinus. Now, if you say it is the opening of the posterior ethmoidal air sinus, then where are the others opening? If you say superior meatus has the opening of posterior ethmoidal air sinus, I think there is one anterior ethmoidal also. Yeah, not only anterior, there is a middle also. So ethmoidal sinus are three of them: posterior, middle, and anterior. Now, if you say posterior ethmoidal sinus is opening in the superior meatus, then where is the middle and anterior opening? That we have to find out. But first you tell me, where is the frontal sinus opening? Frontal sinus, yes. Actually, all of those are opening in the middle meatus. So middle meatus, what is opening? What is there? There is a hiatus semilunaris. Now, if you say there is a hiatus semilunaris in the middle meatus, if you say there is a hiatus semilunaris in the middle meatus, then what is opening at the front is the frontal sinus itself. So at the front there is opening of frontal sinus. Yes. You're telling that frontal sinus open at the front. You're telling that frontal sinus is opening at the front of the hiatus semilunaris in the middle meatus. Yes. And what else is opening here? It is a frontal, and then you will have the anterior ethmoidal sinus. Anterior ethmoidal sinus. So first you have the frontal sinus, then you have anterior ethmoidal sinus. In the hiatus semilunaris in the middle meatus, yes. And then who is opening here? Maxillary sinus. Then there is a opening of the maxillary sinus. So you are telling three things opening here. Yes. Who is most anterior? Most anterior at the front is frontal sinus. And what is behind that? It is the anterior ethmoidal air sinus. And what is still behind that? The maxillary sinus. But all of them are opening in the hiatus semilunaris in the middle meatus. Yes. They are all opening in the hiatus semilunaris in the middle meatus, most anterior frontal, then anterior ethmoidal, and then the maxillary sinus. Now you told that ethmoidal are three in number. Yes. There is anterior ethmoidal sinus and posterior ethmoidal sinus. Where is the middle ethmoidal sinus opening? Middle ethmoidal air sinus is opening in the middle meatus only. So middle ethmoidal air sinus will open in the middle meatus only? Yes. But not in the hiatus semilunaris? No. Okay. So you're telling that there are three ethmoidal sinus? Yes, there is anterior ethmoidal sinus in the hiatus semilunaris, and there is a middle ethmoidal sinus in the middle meatus, and there is posterior ethmoidal sinus in the superior meatus. So these are some openings. You also talked about the eustachian tube. What about that? If we are talking about eustachian tube, then you will see that the opening of eustachian tube is behind the inferior turbinate. In the nasal cavity? No, not in the nasal cavity. It is behind the nasal cavity in the nasopharynx. So behind the inferior turbinate, you have to show it here. Yes. It was the opening of the eustachian tube, where behind the inferior turbinate, where the opening of eustachian tube is behind the inferior turbinate in the nasal cavity. No, not in the nasal cavity. It is in the nasopharynx. So you are telling that inferior turbinate is in the nasal cavity. Yes. And opening of eustachian tube is in the nasopharynx. Yes, actually behind the inferior turbinate in the nasopharynx you have the opening of eustachian tube. These are all MCQs. Okay, what is next? Next is the question. You have to answer it. Tell me, what is the exception? This question is asking for exception of the lateral wall of the nasal cavity, some openings. What do you think, which is the wrong statement here? If you see, nasolacrimal duct opens in the inferior meatus, anteriorly or posteriorly. It is more anterior, guarded by a valve called Hasner's valve. This is a correct statement. If that is a correct statement, then what about this? Posterior ethmoidal sinus opening into superior meatus? Yes, that is a correct statement. Where is the middle and anterior ethmoidal sinus open? If you say middle and anterior ethmoidal sinus, then they were opening in the middle meatus. Yep, correct, middle meatus. But this is a correct statement. And immediately you know that this is the answer. Why? Because inferior turbinate is a separate bone. It's not a part of the ethmoid bone. Ethmoid bone give only superior and middle turbinate. It is not giving the inferior turbinate. That is wrong. This is the answer. You mean to say choice D is okay? Yeah, choice D is okay because the eustachian tube is opening in the nasopharynx behind the nasal cavity, behind the inferior turbinate. So that is okay. The problem is with choice number C, it's a separate bone, not a part of ethmoid bone. So that is your answer. Keep that answer. And now the direction of the nasolacrimal duct. You know there are lacrimal glands and they are producing some tears. And those tears are overflowing the eye. So some of them will actually drain into the nose. And that is called as the nasolacrimal duct. It is opening in the inferior meatus at the anterior end of the inferior meatus below the inferior turbinate. Anteriorly or posteriorly? It is more anteriorly and guarded by a Hasner's valve also to control the flow of tears into the nose. And a question comes, what is the direction of the nasolacrimal duct? You remember, nasolacrimal duct is running downward, backward and lateral. Running downward, backward and lateral. So it runs downward and backward and lateral and then bring the tears to the inferior meatus below the inferior turbinate, inferior concha. There is inferior meatus. That is where it will drain.